Hi there, my name's Leah. I'm going to be talking about patella dislocation in my sports webinar. So a bit of background of the patella bone. It's located at the anterior part of the knee joint. It's a sesamoid bone, and it helps the quadricep muscle move the leg, and it protects the knee joint and supports important muscles, ligaments, and tendons. So the knee mainly works in the sagittal plane with flexion and extension. It allows for a very small amount of rotation in the transverse plane, but it's very important to be able to control this movement in the transverse plane. So it's very dependent on your hip rotators, core stabilizers, and foot and ankle alignment. This is what a patella dislocation can look like, where the patella slides laterally out of the vertical groove of the knee joint. So that's the patella bone, and we have the femur. There could be some potential damage to the cartilage, the inferior part of the bone, and then the tibia, the superior area of the tibia, there could also be some cartilage damage. And for passive stabilizers, these are our ligaments that provide support and alignment to keep the patella in its groove. So the ACL, MCL, PCL, LCL, those all can have potential strain due to a patella dislocation. And this one's a really big one. It plays a significant role in stabilizing the patella and tracking movement, specifically laterally. The medial patellofemoral ligament, it originates the posterior part of the knee joint on the medial side, and it runs posterior, attaches posterior of the patella, and it's kind of this hourglass shape. So this can really take about 50-60% of the damage if the patella slides laterally this way. This ligament is heavily impacted. And then our active stabilizers, so the quadricep muscle group, the vastus medialis pulls the patella medially, and the vastus lateralis pulls it laterally. So these are very important in knee tracking and making sure that, like if you're doing a lunge or something, making sure that the knee is staying vertical or over your third and fourth toe, and it's not caving in too much. So cause of dislocation can be a direct impact, usually a plant and twist, and it can even be a poor step. At risk, young athletes, ages 10 to 20, especially women or young female athletes. Women have wider hips, making them have looser ligaments. And then very tall and heavy men are shallow or uneven trochlear groove, so that's in your knee joint. And then also knee valgus, also known as knock knees. Complications, further down the road, it can lead to deteriorated cartilage in the knee joint, knee osteoarthritis, they go hand in hand, or redislocation. Recovery time, depending on the severity, typically 6 to 8 weeks for return to sport. Surgery may be needed if there's severe damage to tendons or ligaments, and it's very important to build strength again before returning to sport. So some examples of physio exercises that you can start early in the process: single leg raises. This is great to strengthen the hamstring, so it's there to stabilize your whole leg. Eccentric and concentric squat, so learning how to absorb that load again and be able to push yourself back up. This is great for the quadricep group, the vastus medialis and lateralis help track your knee as you squat. Knee extensions, great for quad. And hip abduction, working in the frontal plane. For your hip rotators, your glute med and minimus. And then crunches, overall great for stability in all exercises and making sure you have that muscle activation. And that's all. Thank you.